Now, to understand epilepsy, we should know one important term known as seizure. Okay, what is seizure? A seizure is a period of symptoms due to prolonged depolarization shift of sodium channel present in neurons of brain cell. So, it is prolonged depolarization shift. Now, if you know in our basic video of CNS, please refer to that. And also hyperpolarization, I have mentioned the sodium channel. If it is prolonged depolarized, then the firing of neurotransmitter is continuous. So abnormal activities of neurons, abnormal neuronal activity can be seen in seizure. So now what is epilepsy? Epilepsy, recurrent symptoms of epileptic seizure is known as epilepsy, and it is mostly this abnormal neuronal activity can be seen in the cortex area, cerebral cortex area. Now the etiology involve brain injury, tumor, stroke. It can happen anyway. Now any seizure which is lasting more than 5 minutes, okay, they're known as status epilepticus. Status epilepticus. Okay. Now, as you know, this brain is having two hemisphere. Okay, if it is top view, now when the seizure is affected any of the one of the part of the brain, it associated with the convulsion. What is convulsion? So a convulsion is a medical condition where body's muscle contract and relax rapidly due to seizure. Okay, so that means the muscle contraction become rapid. That's why we have one term known as myoclonic seizure or myoclonus. Myoclonus. So what is that? It is a brief involuntary irregular twitching of muscle. Okay, that's the symptoms of your seizure. Now you have one seizure known as focal seizure. Okay, so focal seizure is nothing but only one hemisphere of brain is affected, and focal seizure is characterized by an aura that is nothing but your perceptual disturbance. Okay, but when a focal seizure is spread one hemisphere to another hemisphere, then it is known as generalized epilepsy, or you can say grand mal epilepsy. Okay, now this can be localized to a particular place, okay, or it can be localized to whole part of the brain. When it is particular place, it's a localized place, we call as partial seizure, partial epilepsy or partial seizure. So what is that partial seizure? Which affect a small part of brain like hippocampus, okay, of temporal lobe. But if the partial seizure spread from primary motor cortex to distal of limbs, okay, then we call them like up to finger, then we call them that epilepsy is Jacksonian epilepsy, because it is spreading from one part of the brain to the distal part of the limbs. Now you have a complex partial seizure which is associated with a unilateral cerebral hemisphere and affect more than one part of the brain like amygdala, hippocampus and neocortex. Okay. Now the generalized seizure, grand mal epilepsy, you often associate with the myoclonic epilepsy. This is also known as tonic-clonic seizure. Tonic-clonic seizure. Okay. Now you have also another seizure known as absence seizures. Okay, absence seizures is nothing but your petit mal epilepsy, which is nothing but your you can say brief loss and return of consciousness. Okay. Now normally this generalized epilepsy also can be seen in the young individual as juvenile epilepsy or Lennox. It is Lennox-Gastaut, G-A-S-T-A-U-T, epilepsy. So now let us see how to treat this epilepsy with an anti-epileptic drug. Okay. Now the first anti-epileptic drug, which is the old one, which is now no more given by the doctors. Okay. It is paraldehyde. Okay. So paraldehyde is also used in IV form to treat your status epilepticus. After that, phenobarbital is introduced, especially primidone, which is a prodrug. Okay. So this is introduced, primidone. Now, what is the phenobarbital? It is again, having a withdrawal and dependence. Side effect is ataxia, which is lack of voluntary movement. Then respiratory problem. As you know, phenobarbital, the barbituric acid, all the side effect. Then you have benzodiazepine. This is a little bit common. Like you have a clonazepam, nitrazepam. Then you have diazepam, midazolam. Now this diazepam and midazolam can be used to treat status epilepticus, and midazolam given IV. Okay, and also temazepam and lorazepam. Okay, so now out of this, your nitrazepam is having skeletal muscle relaxant property. That's why it can be given to treat myoclonic seizure, also T-half 16 to 40 hours, but it is contraindicated in COPD, in a chronic obstructive pulmonary diseases, and any CYP3A4 inhibitors like erythromycin, cimetidine, propoxyphene, calcium channel blockers, they can increase the level of nitrazepam and produce toxicity. Nitrazepam can inhibit the glucuronidation of morphine, and also it increases the suicidal tendency. But its clearance is increased with the help of probenecid. As you know, probenecid can also increase the clearance. Probenecid can inhibit the clearance of penicillin. But over here, it increases the clearance of nitrazepam. So now this clonazepam also used for panic disorders and akathisia, that is the movement disorders. Now after that you have felbamate, the fourth drug, felbamate. Felbamate is the drug. It's having side effect aplastic anemia. It's life-threatening side effect. That's why it is not used so far. But after that you have the next pile of drug which is also used in a large way. That is example is carbamazepine and the valproic acid. So now going to the valproic acid first. Valproic acid, it can be used to treat epilepsy, bipolar disease. Side effect, the mechanism of action of valproic acid, it inhibits calcium channel, it inhibits GABA transaminase enzyme, so that GABA level can be elevated. Then it inhibits histone deacetylase. Side effect of valproic acid, it leads to ossification of children, so that children height can be reduced because bone density reduced in ossification. Okay, and it increases the tendency of PCOD, polycystic ovary disease. It's contraindicated in pregnancy because